Welcome to Telesur. I'm Carla Gonzalez in Quito, and this is From the South. Mexican President Andrés Manuel López Obrador has announced that 161 UN member states are co-sponsoring Mexico's resolution on international cooperation to guarantee equal global access to medicine, vaccines, and medical equipment to combat COVID-19. He said the proposal will be evaluated by the UN General Assembly on April 20th. The resolution urges all UN member states to immediately prevent speculation and all measures to limit access to the supplies needed to contain the pandemic. It also encourages UN members to increase funding for vaccine and drug research. The resolution is based on the premise that the poorest countries will be the most affected, and the pandemic requires a global response based on unity, solidarity, and renewed multilateral cooperation.
And that all countries, independently of their economic situation, can have access to these medicines, to this equipment, and can take care of their peoples, can take care of the sick, and save lives.
Brazilians have reacted angrily to President Jair Bolsonaro's move to fire Health Minister Luis Henrique Mandetta, following weeks of clashes between the two over the country's response to the COVID-19 pandemic. Mandetta was fired on Thursday as the relationship with the president had deteriorated since the start of the crisis. Mandetta promoted isolation as a tool to contain the spread of the virus, the threat of which Bolsonaro has repeatedly claimed is being blown out of proportion. Soon after the announcement, people in several towns banged pots and pans to protest the minister's sacking.
It's a bad idea because the guy was doing a good job. He's a guy who reassured the people, asking them to stay at home. And he went against Bolsonaro's opinions, and so Bolsonaro came and fired the guy.
I think that reflects a lack of perspective. Mandetta is a dumb, but within this chaotic panorama of the Bolsonaro administration, Mandetta was a person who could keep a minimum of coherence.
Meanwhile, President Bolsonaro has appointed oncologist Nelson Teich as the country's new health minister. Our correspondent Brian Meir has the details.
Last night, Brazil's far-right President Jair Bolsonaro fired his wildly popular health minister, Luis Mandetta, and replaced him with a little-known oncologist from a private clinic in Rio de Janeiro's Rio Sul shopping mall named Nelson Teich. As MTST social movement leader Guilherme Boulos pointed out on Twitter this morning, Teich has no public health experience. He has no experience managing in the public health system. This raises questions as to why he would be appointed to take over the health ministry in the middle of the worst pandemic in Brazilian history. Recent publications by Teich show that he supported Mandetta in the health ministry and that he believes in the issue of quarantine, but some of the things he said last night during his nervous 7-minute speech after Bolsonaro introduced him to the Brazilian people indicate that he might want to flexibilize quarantine, verticalize quarantine in accordance with President Bolsonaro's wishes and against the recommendations of the World Health Organization. Since his name was announced, people found old videos of him that are circulating on the internet now that show him giving a speech in which he said during times of scarce resources, life-saving treatment should be prioritized for the young over the elderly. This is a crime in Brazil. It violates the 1988 Constitution, which states that all treatment has to be equal. You can't discriminate against certain population groups. For now, in his acceptance speech, he said that he's not going to make any changes. He's going to give continuity to Luis Mandetta's policies, which is probably a good idea because Mandetta is so popular.
That was Brian Meir from Brazil. People in Bolivia's El Alto region are working to prevent the COVID-19 by using ancestral knowledge. Residents of the country's second largest city say they want to prevent an outbreak by inhaling vapors created with eucalyptus and chamomile plants, which are known to free up the respiratory tract. The de facto government has failed to carry out widespread testing or provide citizens with proper preventive measures, so people have turned to their ancestral knowledge to face the pandemic. Eucalyptus has also seen a spike in use by indigenous communities in other Andean nations like Peru and Ecuador. And specifically in Ecuador, local authorities have announced that in the first 15 days of April, there were more than 6,000 deaths in the province of Guayas, the epicenter of the pandemic in the country. The province usually records up to 2,000 deaths each month. This contradicts the figure given by the government of only 400 and plus deaths in the entire country. And a firefighter in Quito played his trumpet from the top of a fire engine's ladder to raise morale and entertain residents of the capital. Luis Quimbita said he wanted to cheer up those who remain in quarantine to prevent the spread of the pandemic. As of Thursday, the country reports over 8,000 confirmed cases of the virus. The neighbors greeted the firefighter from their windows and rooftops and thanked him for his gesture.
We want to reach out both psychologically and emotionally to people so that they can get through this quarantine that we are all experiencing throughout the country. My passion since I was a child is being a musician, and what is more exciting and gratifying than doing it, hand in hand with my profession as a firefighter.
Argentina's economy minister has unveiled a foreign debt restructuring proposal to try to shed the almost $70 billion in debt acquired by the previous administration. The massive debt has left Argentina with a poverty rate of almost 50% and set off a recession that has been aggravated by the COVID-19 crisis.
What we propose is to change the bond structure, the debt structure that Argentina currently has for another structure that implies a 3-year grace period. There will be a capital cut of $3.6 billion, which is equivalent to a 5.4% reduction on the stock owed and foreign debt, and an interest payment cut of $37.9 billion, which is equivalent to a 62% interest reduction.
We'll take a short break now. Join us again in a minute. Welcome back. More news at this hour. The quarantine to combat COVID-19 in Honduras has forced hundreds to take to the streets to beg for help, while many others are now living in them due to a lack of work. We have more in this report.
In Tegucigalpa, circus workers from Guatemala are unable to return to their home country due to the lockdown imposed to fight the pandemic. They now must ask for money on the streets in order to survive.
We've been here for a while asking for people's help, and thankfully they are helping us.
Whatever little people can contribute, we split among ourselves. With that, we can buy some food, diapers, detergent.
70% of Honduras' population lives under the poverty line, out of which 48% live in extreme poverty, a situation that has been aggravated following the closure of most businesses.
We've seen a massive increase in poverty. This is not only a health crisis, but a social and economic crisis as well. This is starting to get out of hand.
Street vendors have been hit the worst by the crisis, to the point many are now living on the streets.
We sleep where we can, sometimes paying for a bedroom, but we don't really have money, so we often stay out on the street.
Adults and children ask for help on the outskirts of major cities where help offered by the government has yet to arrive.
We are asking for help from the government to give us a place where we can stay.
In Honduras, over 40% of people depend on the informal economy, mainly from selling goods on the street, an activity that is now banned due to the health emergency.
Now to the U.S. New York Governor Andrew Cuomo has accused the federal government of not doing enough to fight the coronavirus pandemic, which has now killed more than 33,000 people in the country.
And we need them to step up and work together. But the federal government cannot wipe their hands of this and say, oh, the states are responsible for testing. We cannot do it. We cannot do it without federal help. Of those 3 bills, The state governments have gotten precisely zero, zilch, nada in unrestricted aid. The state should this, the state should this, the state should this. Yes. Well, what support have you given the states? None.
26 passengers arriving to Puerto Rico's main airport from the United States have tested positive for COVID-19, fueling calls to suspend all flights into the country. Governor Wanda Vázquez previously called on U.S. federal officials to ban all flights to Puerto Rico from U.S. cities with a high number of coronavirus cases. But the only decision adopted was to direct all flights to the island's main airport. Puerto Rico has so far reported over 1,000 COVID-19 cases and 58 deaths. The opposition in Jamaica have called on Prime Minister Andrew Holness to impose a nationwide lockdown to stop the spread of COVID-19. The People's National Party said the Prime Minister's failure to take decisive measures is worsening the pandemic in the country. The call follows an announcement by the Ministry of Health and Wellness that the country has recorded 18 new cases of COVID-19, pushing the total to 143. 5 deaths have also been recorded, while 23 patients have recovered. On Thursday, the United States has blocked COVID-19 test kits which were destined for Jamaica. The government, a close U.S. ally in the region, is now awaiting supplies from other sources.
We had some delays, I'll admit, because we had some supplies coming out of a particular country, and those supplies were blocked for the particular country and by the country. The U.S. of course. You've heard the laws. You've heard the laws by the position thing. So we no, I'm not afraid, but I'm just saying they have acted in their interest. We have to act in our interest. So in the meantime. In the meantime, Mr. Speaker, we have had to recalibrate our strategy in order to get from other sources, and that led to some delays. But we're getting ahead, and by the weekend into early next week.
Barbados has not recorded any new COVID-19 case since Wednesday, according to the country's Ministry of Health. In its latest update issued today, the ministry said it's the first time since the first 2 cases were diagnosed on March 16th that the island has not recorded any new case of COVID-19 for 2 consecutive days. The country has so far recorded 75 confirmed cases of the virus, 5 people have died, 15 have recovered, while 55 are undergoing treatment. In the Dominican Republic, the Ministry of Health says the number of confirmed cases of COVID-19 has exceeded 4,000. The ministry on Friday announced 371 new cases and 4 deaths during the last 24 hours. With a total of 4,126 cases and 2,000 deaths, the country is among the worst affected in the region. And the Caribbean community and its heads of government agreed on a collective approach to international financial institutions to meet the fiscal challenges arising from the coronavirus crisis. They urged that the criterion of GDP per capita not be the sole consideration in addressing their needs. The bloc also agreed that additional technical work would be undertaken on the development of a common public health policy, which will be considered at another meeting in 2 weeks. The media fraternity in Trinidad and Tobago is mourning the loss of former actress, broadcaster, and media trainer Barbara Asson. Asson died earlier on Wednesday at the age of 91. The late stalwart was an actress before joining the media, appearing in productions in Trinidad and Tobago and in England, where she studied. She has been described as a talented and formidable broadcaster with a penchant for perfection and storytelling. We'll be right back with more stories. Don't go away. Thank you for joining us again. The head of the World Health Organization has expressed concern over a recent jump in COVID-19 cases across Africa.
Although we see encouraging signs in some countries, there are worrying trends in others. In the past week, there has been a 51% increase in the number of reported cases in my own continent, Africa, and a 60% increase in the number of reported deaths. With the current challenge of obtaining testing kits, it's likely that the real numbers are higher than reported. With WHO support, most countries in Africa now have the capacity to test for COVID-19, but there are still significant gaps in access to testing kits. We're working with partners to fill those gaps and help countries find the virus.
A team of Chinese medical experts has arrived in Addis Ababa, Ethiopia, to help the country fight the COVID-19 pandemic. Our special contributor, Jerome Chala, has been following this and sent us a report.
A flight arriving in Addis Ababa has brought over 12 Chinese medical experts. The first batch of medical professionals is here to support Ethiopia's battle against the coronavirus, as well as advise the Africa Centers for Disease Control.
This is a very strong delegation, and they will help Ethiopians to enhance its ability, because this pandemic is a very serious threat to the humanity. So only by international cooperation, by strengthening international cooperation, can we defeat the common enemy.
These medical professionals from China have been on the front line of Chinese fight against COVID-19, and they have had the experience of handling many cases, as we've been told. But more important for Ethiopia is now the kind of contribution they have brought with them here that is going to help this country defeat the coronavirus.
This is our team. We have we have ICU doctor, we have nurses, we have a respiratory physician, we have someone from CDC for epidemiology. We also have from emergency department, and I'm ID physician. So we have a variety of the specialties.
Ethiopia has considered China's effort of sending these medical professionals alongside different medical consignments as a strong gesture of solidarity and friendship.
China had faced this difficulty before, and then now they are overcoming it, almost they are defeating it, and then now they are lending their hands for friends. Now Ethiopia is one of its closest friends, and then this is also the epitome of that strong fraternal relationship.
The Chinese medical experts have a lot ahead of them, as number of COVID-19 cases are rising by the day in Ethiopia and across the continent. The team will be operating alongside their Ethiopian counterparts.
Because we have continuously worked for fighting COVID-19 for 3 months, we come here to try to provide some kind of help, to share some of our experiences from the front line. So we will see what we can do here, depending on the local situations.
China has already said it will send similar medical missions to the rest of the African continent soon.
Welcome to Ethiopia.
Jerome Chala, CGTN, Addis Ababa, Ethiopia.
Jerome Chala from CGTN. Now in South Africa, police have arrested the head of one of the country's largest mining firms for forcing workers to return to work despite lockdown regulations put in place to stop the spread of COVID-19. Mark Munro, the chief executive officer for Impala Platinum Holding, was arrested on Thursday and appeared in court on Friday, facing charges of disregarding the Disaster Management Act. The Mine Workers Union has welcomed Munro's arrest, saying it must serve as an example to all businesses that are putting profit ahead of workers' lives.